So what's the relevance to this? The relevance is the life expectancy of a drug in a human, and this includes pets as well, determines the frequency with which we're going to be writing prescriptions. Okay? And if you take anything away from this portion of the presentation, I want you to think about that. I mean, to get an understanding of why one day you may be writing a prescription for fluoxetine, generic Prozac, that's once a day, and the next day you're going to be writing one for, say, an antiviral like Zovirax, generic acyclovir, for 5 times a day. The reason we have differences in frequencies like that has to do with how long the drug lives in the body, or the half-life. I threw this in as an afterthought. You know, pharmacists have their own language. Half the time, you know, we speak Latin kind of stuff. We have to learn that in pharmacy school. But sometimes I'll say the SIG. When you write a prescription, the SIG, or the signatura, which is Latin for directions to the patient, that's the line that says, take 1 tablet 3 times a day. Okay? So, relevance. As a general rule, longer-acting drugs dose less frequently, shorter-acting drugs more frequently. Okay? Now, you may be thinking, so what? You know, what's the big deal? You know, this guy certainly isn't going to ask us to memorize thousands and thousands of half-lives, and I certainly wouldn't do that. But I'm here to tell you, about 3 or 4 times a year, I get prescriptions where the frequency of that medication does not match the kinetic features of the drug they want. And we've got 4 examples that we're going to show you. Just a couple of notes about these before we get into that. Oops. I was going to take the actual prescriptions and try to find a way to, you know, stick them up here. What I've done instead is, oh, that jumped up. That's, okay. Here we go. Put them up here. What I've done is just reconstructed them. I just basically wrote out the guts of the prescription. Of course, we had to leave off the patient's name because of HIPAA violations, but to provide an air of authenticity with these, there's going to be some names on here you might recommend. Okay. All right. Dr. Marinelli knows I did this. Dr. Wilson doesn't. Marinelli told me to go ahead and use Wilson's name. True story. And if Wilson doesn't like it, he can bitch at Marinelli. And that's why I wish they were here. They're both split. So, okay. I love those guys. We have a lot of fun. Let's look at the first one. Okay. This prescription was actually written by a third-year medical student. Ignore the name, of course. A third-year medical student at my hospital, Samaritan North Lincoln in Lincoln City. I was called over to the hospital here about 2 or 3 years ago to fill in for a pharmacist friend who was on vacation. Got a call from one of our senior physicians who said, Mike, I want you to look at this prescription that the med student wrote, and maybe you could talk to her about what's wrong with this prescription. There's actually 3 or 4 things wrong with this prescription. Okay? So I did. This is the prescription that was written. Now we're going to move forward. We're going to talk about precisely what's wrong with that, but we're going to kind of review ceftriaxone. Has anybody had any experience with that drug? Anybody? You have? Okay. Brand name is Rocephin. This is a 3rd-generation cephalosporin. The cephalosporins have 4 generations. What defines those is how long they've been around. We have another prescription we're going to look at, which is another cephalosporin here in a few minutes. The later generations are a little bit more specific for certain types of organisms. So Rocephin's actually been around for a while. There's 4th-generation cephalosporins. There happens to be only one 4th-generation cephalosporin, but we don't need to talk about it. This is a misspell right here. I wrote this thing in the middle of the night. I was trying to get ready. It's supposed to be salmonella, so sorry about that. Those are the indications: meningitis, STDs, Lyme disease, salmonella. It's actually useful for quite a few different medications. It's a long-acting drug. It's got a half-life longer than 8 hours, which is long-acting for an antibiotic. Okay, maybe not for other classes of drugs, but that's a long-acting drug. The maximum dosing is usually daily. In cases of real severe meningitis, it can actually go twice a day. And in some cases, one dose will do the do the job, and that's usually the case with STDs. Now, Rick was in the hospital for a strep pneumonia. Okay, doctor was concerned that that would go into a meningitis, which sometimes I'm told can happen. I'm not really a hospital pharmacist. Okay? So, given that kind of information, let's talk about what's wrong with this prescription. Okay? First of all, we want to look at the strength. Like we said, you can give one dose, actually less than 250 milligrams. This medication can actually treat STDs as low as 125 milligrams, one-time dose. That's not why Rick was in the hospital. Well, he was in the hospital, like I said, for a strep pneumonia, so 250 milligrams would not be appropriate. Okay, 1 gram daily would be more like it. PO, this drug is not available orally. Okay, this is only an injectable drug, IV or IM. Okay, and I brought this up. I know I'm not sure about you guys with hospital practice, but I know, because I've hung around you guys for 10 years now, that you do injections in your office. And this is certainly a medication that can be given in the office. I had a shot of this once myself for some cellulitis. As pharmacists are on our feet for a long time, and sometimes it gives rise to other kinds of problems. TID, the drug is never dosed TID. We said QD, and only in certain instances is it going to be dosed BID. Okay? In 7 days, maybe, maybe not. Okay? Patients being discharged, I have actually seen people discharged from the hospital with severe infections come back into the ER every day for 3 or 4 days to get an injection of this. Okay? So there was a number of things, actually wrong with this prescription. Most notably the SIG on that, the TID. Okay, what might we expect if it's dosed as such? I ask that question just so we know if you dose more frequently than what the literature supports through the half-life, you're going to get the drug backing up. Start to see toxic problems, in some cases relatively quickly. Okay, this third-generation cephalosporins are nephrotoxic, dose-dependent. So you get that stuff backed up, and we're going to run into some real problems. Also get GI disturbances, lots of diarrhea, those kinds of things. Okay? I'll ask you, what might be a better choice? I mean, the med student, well-meaning, and I mean, that's why we go to school, is to learn this kind of stuff. But what might be a better choice if you want to discharge somebody off of this drug, but you want to make sure they stay with a cephalosporin, type therapy? Anybody have an idea what drug might be suitable? There's actually 2 or 3 of them.
Are you going with the same brand, same family?
Yes. Keflex. Absolutely. Thank you. Yeah, cephalexin. As a matter of fact, that's pretty much the drug of choice, in cases like this. That's absolutely right. Let me see if I have any more notes on this. Does that make sense? Okay. Great. Ceftonir, Cefadroxil, Omnicef, there's a bunch of them, but cephalexin is certainly the least expensive, fewest side effects with that. So that's a good choice. Okay, the next prescription I'm going to show you was written by a physician in Tillamook, a good friend of mine. He wrote this prescription. Actually, his assistant or nurse wrote this prescription and stuck it in front of him, and he signed it, and it came to my pharmacy, okay? This is Dr. Wilson. Dr. Wilson has a dyslipidemia, okay? Vytorin 1080, 1 TID, number 90, refill times 1 year. Okay? I can't believe I did this stuff. It's later in the evening, so bear with me. Okay, everybody know what Vytorin is? This is going to definitely be new to your formulary. Anybody know? This is a combination drug. This has 2 drugs in it. Obviously, you'll be able to tell that anyway by right there, by the dual numbers. Okay? There's 2 drugs in this. This is for lipid problems. It has ezetimibe, which is Zetia. That controls lipids by blocking their absorption in the gut. Drug's been in the news a lot. The feds say it's not effective. I have people who do just fine with that. And then simvastatin, which is